This is Chapter 2, Motor Development and Motor Learning for Children. This is Part 1. The overview of this chapter, plus this video and the next video, is that children progress through a predictable stage of motor development. No two children have the same physical characteristics or the same age and the characteristics. Motor development is this: changes that occur in the human movement across the lifespan. These are biological characteristics and the environment of which the individual lives. Motor learning is a permanent change in the performance of motor skills. Motor learning is motor performance, as learning cannot be directly observed, and a teacher that considers developmentally readiness of children are planning for focus on developmentally appropriate activities and not just age. When we look at growth patterns, we look at genetically determined. There are predictable patterns that children will experience. The height, weight, and muscle mass increase most rapidly during infancy. There is a steady increase in height, weight, and muscle mass throughout childhood. Early childhood, ages 3 to 5, gain in height is approximately 2.75 inches per year. Ages 6 through adolescence, the gain in height is approximately 2 to 2.5 inches per year. Average weight gain during early childhood is approximately 4.5 pounds a year, and average weight gain during later childhood is approximately 6.5 pounds a year. Years of slow, steady growth help kids understand how their body moves. Growth patterns follow a predictable pattern. That means, again, that infants learn to creep or crawl before they actually learn to stand and walk. Here's a picture of kids being the same age, but obviously their growth patterns are different. During pre-adolescence, boys will show longer legs and arms, and girls will show greater hip and thigh width. There are physical differences in early to late childhood. They're very minimal. Boys and girls can compete equally in sports or in physical motor skills. They have similar amounts of muscle bone mass during preschool and early primary grades, and adolescence sees a greater limb growth and trunk growth. Pretend play lets children ages 2 to 4 move in their environment as well as assist in the development of communication. If you can remember, movement helps in communication. It's what the children are trying to say, and they move because they have not understood the language enough to express themselves. Children between 4 and 7 have a difficult time seeing the big picture because of the concentration needed to complete individual motor skills. Children between the ages of 2 to 4 have a difficult time working towards a group goal because of their egocentric nature. Children between 7 and 11 begin to see the big picture and are learning to anticipate what may happen next. Practice opportunities that encourage individual or maybe partner or small group is the best way to teach motor skills. And children the age of 2 to 4 have a difficult time sharing or cooperating with others. That's the reason 2 to 4 years is a little bit more difficult for them to engage in game sports. Cognitive implications. Between ages 4 to 7, children have a difficult time focusing on more than one motor component. Design activities low in complexity and require focus on one movement. Labels such as star, loser, the fastest, klutz may have a long-lasting impact on the child's feeling of success in movement and the desire to participate in the social groups. Kindergarten children learn social skills through play and interaction in the classroom. Children ages 7 to 11 are able to problem solve and focus more on one task at a time. Encourage this development, and the critical period when children should master control is in the muscle groups is around 3 to 5 years of age. Through play experiences, children emerge from solitary or alone play and to develop cooperative and leadership skills in elementary school age. Effective implications: through physical activity, children gain a sense of competence, self-worth, self-esteem, and this may be hindered if children perceive that they are less capable than other children. Control of the head allows the infant to elevate the chest and eventually roll over. Voluntary movements begin at this head and progresses downward as the young child is able to stabilize and control the body. A controlled roll enables the infant to eventually elevate to a seated position and then to a supported standing position. Elevation of the chest after rolling encourages children to use the arms to crawl. As legs become more involved, creeping across the floor begins. Support upright locomotor may occur 8 months of age. As the child is able to maintain balance, less support will be needed. Most children can sit by 8 months. Most children will pull themselves to an upright supported stand by 10 months, and most children will creep by 12 months. Initial upright locomotion is characterized by stiff knee and ankle joints. As the maturation process continues, children eventually gain greater control of these two joints and a normal walking pattern develop. Torso to limb development: voluntary movement control comes from the center of the body and moves outward. Gross motor control is evident before fine motor control. So if a child in the classroom is having trouble drawing or coloring or cutting, then gross motor skills should be taught. Gross motor skills involve large muscle control that occurs prior to the control of more precise movement, which typically involve eye and hand coordination. You can look at this drawing, big difference between a 4-year-old and a 7-year-old. You can see the detail. Definitely the 7-year-old is mastering the fine tune of fine motor control. In order for children to gain control of motor skills, there needs to be two processes. Differentiation is the progression of skills from gross to fine, and integration, the coordination of the muscle and sensory systems. Differentiation is the progression of fine motor movements developed from gross motor movements. Physical activity emphasizes the development of gross motor skills. Classroom activity incorporates fine motor skills. Children need many opportunities to practice both large and small muscles in order to feel confident. Abnormal motor development. A balanced diet and additional water consumption are critical to the development of the fetus in order to provide necessary nutrients to assist in the development. Recreational drugs or prescription drugs may be used by the mother during pregnancy and may lead to abnormalities in motor development. Mental retardation, even though that's an inappropriate term to use, it's still used in clinical settings. A better term would be intellectual disability. Then we have attention deficit disorder, low birth weight, central nervous system, eye defects, and so on and so on. Readiness to learn. Each child has his or her timetable and rate for the extent of development. Tradition across these is the development of appropriate opportunities to practice, encouragement, feedback from a knowledgeable instructor, and a learning environment that includes appropriately sized equipment, facilities for practice, and ample time allotted for practice. All of that helps in readiness to learn. In regards to stages of performance, the learner at the beginning level will get the idea of what the body looks like and coordinate the body to perform the skill. Readiness, movement educators need to consider rather a design movement task matches the ability of each child, and developmentally appropriate activities meets each child's ability based on several things: fitness, skill level, body size, age, and readiness. To make instructions effective, teachers must consider the developmental level of the student and not merely age. Accounting for readiness: has the child mastered the prerequisite skills? How does the child look when performing motor skills or a lower complexity? Is a child capable of manipulating equipment, or does the equipment control the child? Stages of performance. The stage of performance and stage motor development will influence how you teach children. Children progress through these stages of motor skill development independent of their age, and that's important for you to understand. When movement educators recognize the stages of performance, their children and meet their needs at their level. Beginner, the learner is getting the idea of movement and how to coordinate the body. Intermediate, the learner is beginning to refine the movement and make fewer errors. Advanced, the learner is automatic in performance of a skill and thinks little about the execution of the skill. So at the beginner level, concentration is a must. It's exhausting to learn a skill from the beginning. Children may be assisted by learning from having them to talk to themselves, call out the skills, teach them verbal cues. Intermediate, children have a better sense of what actions that need to be done to perform a skill. They provide critical clues or cues to help them refine their skills. Verbal cues are going to be used when you teach your assignments. You'll need to come up with verbal cues, and there's more information in the book. Keep the performance environment positive and successful. Children must be successful in order to continue. Advanced level, few elementary children reach this stage due to limited opportunities to practice. The performer is consistent from one practice attempt to the next. This is the end of Chapter 2, Part 1.